We're going to look in detail next at some forms and documents. And on our EH&S website, we've created a dedicated page to the COVID-19 FEMA grant. And it's got some information about eligible expenses, and then it's got hyperlinks to each of these documents. They're PDFs, so you can download those if you want to look through them now as we go through this, or you have them for reference later when you complete your application. So there's the actual application form, and then there's 5 different summary forms. All may not be applicable to you based on your eligible expenses, but those are available there for you. If you have equipment that was involved, FEMA has a schedule of equipment rates. So when we say we used a pickup truck to go clean a building, let's say, we can claim the hours that we use that truck to deliver the materials and our employee there and back and such. And they've got set rates for the pickup truck and everything else. So that schedule defines what they pay per hour, per tonnage, whatever the category might be. So we'll look at those forms and documents right now. First, we'll start with the application form itself. You can tell this is a true government form. So we've got 4 different sections and then 3 different schedules that we're going to look at this morning. The first is the project application. So let's jump into that. At the very top of the application, you're going to see this general information we provided earlier, the declaration number and the FEMA public assistance code. Please list your department or college or your business unit, whoever you're completing the application for. And then to be consistent, let's use this project application title, FEMA COVID-19 grant. In the upper right there where we've got marked NA for the project application number, Cindy and I will create those internally as we enter this information into the grants portal. What we're going to have to do is take these physical documents, and FEMA's got an electronic application. We put everything into that to make the actual application. So we'll assign those internally. So that's the first section, very straightforward. Section 2, in terms of the scope of work. So this open text box to fill in a description of what you did. So this could be a sentence or 2, just a high-level description of basically justifying why we're claiming these expenses, because it did eliminate or reduce the threat to our public health and safety on campus or at our facilities. So it could be had to disinfect buildings so essential employees could work. It could be other items. So just make sure this is where FEMA is going to look back and say, why did you have to purchase these things? Why did you have to do this work? How does it tie back to the emergency declaration? So that could be just several sentences there. And then you're going to have some check boxes you can select for different activities that you actually conducted. Not all will be applicable. I won't go through all these in detail, but you can get an idea. Facility disinfection probably will be on the top of many people's lists for cleaning buildings. EOT, our emergency management group, to my knowledge, didn't have like a hurricane type emergency operations center response, but Kenneth, correct me if I'm wrong, or we can talk offline. Disseminating information to the public, providing warnings and guidance. We talked about signs and things like that. So you're just going through and selecting which one of these did you actually incur. As we enter this into the grants portal online, these are going to trigger additional questions for documentation and things that we'll have to provide. So emergency medical care might not apply to everyone. Again, we're expecting College of Medicine, Student Healthcare Center, and others to have these types of expenses, so I won't go into detail on those, and those are pretty straightforward explanations. If any of this doesn't make sense in terms of the definitions or what might fall under those, please let Cindy or I know. We'll give our contact information at the end, and we're more than happy to chat with you about those. That mentions the PPE decontamination systems. So if Bill mentioned equipment, if you have to decontaminate that machine at the end of the day, that might be something you want to track here. Medical services for disease testing mentioned. Employees and student testing is not going to be covered. Alternate medical facilities that we may have had to set up, like community-based testing sites, that may not apply to everyone. Sheltering, we did have and do have a non-congregate sheltering setup plan in place that emergency management is leading. We had to use it with some students at the onset and expect this fall, in a month or so, we might have to enact that again. So that might not apply to everyone other than housing or student affairs, but that is an eligible expense, and we've got approval from FEMA for those. The bottom box, select the method of work that you've used. Again, I don't think anyone had to establish temporary facilities or stage resources or really any of those other than purchasing materials and supplies. The italic at the very bottom, if you did have to set up temporary facilities or stage resources, there's an additional schedule that you have to fill out. So just be aware of that, and we can help you walk through. I think that'll be an exception more than the rule, so we won't go into detail on that. For section 2, the locations that you performed any of these eligible work at, FEMA will want to know the building address and GPS locations. I've gone through this with hurricanes, so if it's just at your building or if it's multiple facilities, please let us know those addresses. That can just be a spreadsheet attachment if that's easiest for you, but they do want to know where the work occurred. And let me back up. So I think that's it for section 2, as I covered a lot there. So let me pause and see if there's any questions that popped in for section 2.
No.
All right, section 3, this is the cost and work status information. So number 1, do you want to request expedited funding? No. FEMA did set up a process with this disaster where we could do an expedited process, but we would only be funded at 50%. We don't want to do that. We want to apply for the full 75% along with the state's portion. So the answer here is yes for everyone. The next question, do you expect your costs will be greater than or equal to their threshold for a large project, 131,100? You may answer yes or no on this depending on your situation. We still want you to complete 2 different forms where it's, if you answer no, it says please complete Schedule EZ. All the information on EZ is going to be on a different form. And I don't mean to be confusing here. So just, you can answer as you need to on that, but we'll tell you which forms to complete. So we have all the information we need to submit it on your behalf. That's just their threshold to determine if it goes into a large project flow or a small project flow. The next section, they're basically wanting to know, are your activities done? So when did your eligible activity start and when did it end? If we're tracking these through 6/30, so most, if not all, should have been completed by 6/30 on that. So that answers that. The net total cost on number 2, you won't know that until you actually go through the other schedule forms. So you'll circle back to this at the end and enter your total project cost once you get to that point. So that's section 3. Section 4 is a certification. We'll ask you to complete these sections, numbers 1 and 2. So for number 1, have you applied for funding from another federal program? So this could be Department of Health, CDC, CARES Act. If so, list what programs you've applied for federal funding for, and then have you received? So have you applied and have you received the funding? So what is the status of that? If you haven't, it's been received but hasn't been approved or denied, whatever the situation might be. If you have eligible expenses that were covered by any of those other funds, would be CARES, DOH, CDC, there's no duplication of benefits with FEMA, right? They're not gonna, the federal government's not gonna pay us twice for the same expense. So you should remove those expenses from this grant application. If you don't, it could be deemed ineligible and the whole grant could be invalidated. So it's important to separate those costs out. So once you've answered those, sign and date that portion to certify that is true and accurate. The second part is the general certification, which covers, it's our responsibility to provide these things, to incur these costs because it was related to COVID, to reduce the threat to public health and safety. And you can read through that. It's a lot of legal language. Basically, we're complying with all federal guidelines. We're not applying for duplicate expenses. If there's any environmental impacts, Cindy's going to mention briefly, there's a separate form that you'd have to fill out, but we're operating following all state, federal, and local laws regarding that. Documentation retention. So you may be familiar with this if you've applied to other federal grants, so I apologize if it's not new information, but we obviously need to retain our records. So Cindy and I will keep a copy of what you've submitted. We also recommend you keep a copy on your end. There's a chance we will be audited and we need to provide other documentation if that occurs. So just hang on to your records. And then we'll ask you to sign again and date, or I guess there's no date, just sign it on that section. Number 3, you can ignore. This is if we had hired a third party to complete applications for us, they would complete that section. So that wraps it up for the application portion. I'll pause here to see if there's any more questions related to the application. Okay, Rosemary had asked, are computer purchases for telehealth eligible? I haven't gotten clarification on that, Rosemary, so let me add that to the list. I'll ask our contact at the Department of Emergency Management. And Cindy, I'll pause here to let you go through the schedules.